Okay, Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon, everybody. My name is Basma Balnaw, CBR instructor. Welcome to my presentation. Inshallah, today I'm going to talk about BLS training and how we are practicing this BLS high quality CPR in our hospital. And actually, I would like to thank Clinical Skill Lab and Simulation Center to allow me to allow as Life Support Training Center, which in under Nursing Administration at King Abdulaziz University, to share and show how we are reviewing our resuscitation practice given by healthcare practitioners in clinical areas according to updated guidelines according to American Heart Association, and how to maintain high quality CPR before COD team will arrive. Okay, so now we're going to move to what is the role of nurses during the COD. But before that one, for us here, all patients who experience cardiac or respiratory arrested will be given cardiopulmonary resuscitation by competent nursing staff, okay? And this for all new staff who is starting working in our hospital should be initially certified in BLS, Basic Life Support, within only 2 months when they start join to our hospital. And for this who have already certified from outside, what we are doing for them, we are just refreshing their mind. So they are, they are attending a course, okay, the complete course, but they will not have the written exam, only the practical session, okay, with the sure, yani the performance, okay, skill-less assist. Okay, and for the CPR resuscitation skill will be reviewed at least twice annually. So every 6 months, the staff, the whole staff in King Abdulaziz University Hospital will attend the Code Blue drill in the year twice. Okay, so we are refreshing their mind, we are checking their performance, and if they have any question, if there is any update in regarding resuscitation, so actually we are doing that one. Okay, now we're going to move to the role of nurses during the COD or when patient is arrested in front of them. Okay, so we have actually 3 nurses. The first rescuer is identify cardiopulmonary arrest status, and this is the first step in basic life support. You know, if you saw somebody arrested in front of you, what you have to do. So first thing, you have to tap on the shoulder. Don't checking, tap, okay? Tap on the shoulder and check their response. Maybe he's in deep sleep, so he will wake up by that time. Next, then direct the second rescuer to activate the code blue and get crash card by directly say, you know, but you have to identify which type of patient, adult, pediatric, or infant. So you will just say, call for adult code blue and get crash card. Then you will note the time of the arrest, because for us here in our hospital, what we are doing, the primary nurse or the one witnessed the arrest will be the recording nurse. So you have to know the time. So you will write that one in your code blue form. Then you will assess breathing and pulses simultaneously, both together within 10 seconds. So don't be hurry, okay? And check in pulse and breathe, okay? Take your time, count from 1, 2, 3, 4, 5. After 5, it will be acceptable. 5, 6. If you didn't feel any pulse, any breathing, there is no chest rise, you can start your CPR, high quality CPR, till the team will arrive to you. Okay, so this is the first rescuer. Then, now we'll move to the second rescuer. What he will do, he will activate the code blue form, code blue appropriately by dialing 2222. Actually, this is our number in our hospital, King Abdulaziz University Hospital, for the code blue. And just in your hospital or institution, just see what is the number that you're supposed to dial for the arrest patient. Then she will ask the second rescuer to get the cardiac board and ambu bag and go to help in high quality CPR. As you know, chest compression, it is not easy. So the first rescuer, maybe he did 1 or 2 sessions of chest compression, maybe he's there, so he needs somebody to help him to relieve for switching. And then so the third nurse, she will come to help directly. And she will, then the second rescuer, what she going to do? She will bring the crash card. She will come with, after she will announce the code, she will come with the crash card and make sure the cardiac bore is placed, because as you know, the bed is soft. So for the compression, we need a hard, flat surface. So the cardiac board will help with in that. Then she will assist for the cleaning of the airway by what? Using OBA or pharyngeal airway, and she will provide suction catheter, which is actually located in the top of the crash card. So she will just open that one, connect it, and she will just put it near to the one at the head part in case of there is any secretion from the mouth or nose, she can do suction directly. Then she will provide she will attach oxygen to 100%. When the third nurse, she will come, she will start the code blue with, or ambu bagging, with ambu bag is plain, nothing on that. It will not attach to oxygen or reservoir. But this is the role of the second nurse. When she will come, she will attach that one, because actually even with the 21% oxygen, still patient can survive. But during the arrest, it should be 100%. So it will be the role of the second nurse. Then she will turn on the AED or defibrillator. Actually, our defibrillator is consist of AED options, and in our hospital, in the new guideline, who is those people who is BLS certified, they can apply AED and give shock through the AED option. So she will just select the AED option. Then she will analyze the rhythm and give shock, but she's supposed to follow the safety of defibrillator. Then she will help in high quality CPR. Okay, I hope it is clear. Now we'll move to the second rescuer, which is the one we said that she is bringing the ambu bag and cardiac board, and she will confirm that she put the cardiac board, and she will start to help in high quality CPR. Either she will take the turn of ambu bagging, or she will start chest compression. Maybe the first rescuer is already tired, so she will start chest compression. And they supposed to switch rule, every 2 minutes, or if the compressor is there, so they can switch rule. And minimize interruption. One of the components of high quality CPR, minimize interruption less than 10 seconds. So for switching, they're supposed not to be exceed more than 10 seconds. Then she will continue high quality CPR till the team will arrive and deliver a cycle of chest compression at the rate of 100 to 120 compression per minute. And she will switch the rule of chest compression to ventilation after 2 minutes and limited again interruption to less than 10 seconds. And actually this all is the component of high quality CPR. Now what we're going to do, we'll show you one of scene. Actually, we did drill. So by the video, after that, maybe we'll talk about it one by one and what these three nurses, what they did. Yes, escape from. Oops. It's almost unfinished. Oh my God. What is it now? 5. ممكن الفيديو الثاني نشتغل أنا أتكلم مو دحين. نشوف بعدين ولا ما. طيب لأن في الفيديو الثاني، حتى الفيديو الثاني حيكون صح. Okay. Oops. Great job. Okay. Okay. So actually, as you saw in the video, what we have done is this is our practice for the code blue for the role of nurses, first and second and third, what they are doing during the arrest, or how they are helping each other. This was one practice done in 6th floor. So our staff, we are having 2 practice, as I told you, in 1 year, every 6 months, they will have one in the 6th floor in nursing education, and we are thank them for this. And the second one is we are doing it at the unit base in the clinical areas, so they will have the real practice. Now maybe we can debrief. I will just show you another video from other view. No problem. So, as you saw here, the primary nurse she was wondering why the patient or her patient, yes, he's not responding to her. Then he did what he did. He checked the response, he tapped on the shoulder, and then he asked for help because he's inside the room. And when he said help, see, as you saw, the other nurse, she came to help him. Okay. Then he asked her to call for a code and get crash card. Then what he did, he checked, he is now checking for a pulse and breathing for not less than 5, not more than 10. As you can hear, he is counting. Then he notes the time of the arrest, as we said before. Then he start high quality CPR and he start with chest compression, waiting for the help to come. See, he cannot do it because he's still maybe down on the floor. But we will see if the second nurse or third nurse she will come. What she going to see? Good. She brought the photo stool to him to allow him to go up a little bit and start high quality, CPR. Now, see. Yes, after 30 compression, she started to give to breathe, and she was counting because each breath was supposed to take 1 second. And as I told you, now they are helping each other to attach the code blue cardiac board, attach, and she exposed the chest for next person to attach the TCP, and she went to the head part to continue giving breathe. See now the second nurse, she came with our crash card. As you can see, our crash card, it consists of medication. Actually, it is in the top of the crash card, the defibrillator in the top also. In the drawer, we have intubation items, we have IV items, medication items. Even we have oxygen cylinder for suction and to deliver oxygen also. So all in one crash card. In case of this happen, let's say it is not in the unit and we don't have wall-mounted oxygen or suction, so it is complete, even if in the main entrance, in OPD, and these places that you will not have oxygen sources in the wall. So our crash cart is really complete. Then we'll do what she did next. She makes sure that the cardiac board is there and attached, because what we are thinking, maybe the third nurse, she will come and she will just go ahead and help in high quality CPR, and she will not have time to insert. So the second nurse, she will come, she will make sure that cardiac board is inserted. Next, what she's doing, okay, she gave the one at the head part, the OBA, because as you know, during the arrest, what is happening? The patient will lose his control of soft muscles, so the tongue will go back and it will obstruct the airway. So for the OBA, it will help in opening the airway, and so we will see next what she did. Yes, see, she is opening the suction, and she give it to the primary or the third nurse in case if she needs, it will be ready for her. Now, as I told you, the third nurse, she will start ambu-bagging with room air, but it's supposed to be 100% during the arrest. So it's good. See what the second nurse she did? She attached oxygen tube with 15 liter, and she attached also the reservoir. Lastly, what she is doing? She power on the AED mode. Good. And as you know, the AED will give the prompts what you have to do next and next. Now she is opening the bats, preparing to attach it. And sure, as you know, for the bats, there is always diagram for those who is not seeing in low volume pod areas. Might they are not using AED frequently. So Anyway, there is diagram in the drawing on the pads, so she can just follow that one and put it. And Edith is very smart enough to tell you what to do next, what to do next. Okay, they attach the pads. Now time for analyzing. So during analyzing, what you have to do, you're supposed to clear the patient, nobody touch him. Otherwise, it will affect the rhythm. From unshockable, it will turn to shockable. Then she gave shock, but you should make sure before you will give shock, you have to clear the patient and nobody supposed to touch. Oxygen supposed to be 1 liter away, 1 meter away. And then you will continue high quality CPR till the advanced team will come to you. So actually this was our practice in the hospital. I think I'm ready. If you have any question, any query, you can ask this time. Thank you very much for attending. No more question. Do you have any question actually? If you have any question, you can ask about our practice in our hospital regarding basic life support and high quality CPR. If you have any question.
Good afternoon, Miss Basma. I
Yes.
have a question for you.
Yes.
If you have 3 nurses handling each procedures, who's going to observe them? They're doing the skill right or wrong?
During the actual code blue?
Yes.
Yes, actually, for us here, the head nurse usually she is attending the code blue, and also the supervisor. And sometimes one of us, if we are not busy, LSTC team, we are attending the code blue. So actually, we are reviewing and we are seeing how the staff they are practicing this resuscitation skill.
Yeah,
And if we see that one of the staff she is not following what we are doing or training regarding that one, we are just send her again for more training to 6th floor.
Thank you, Ms. Basma. Thank you.
Any more question? For LSTC Life Training Support Center, actually we are providing all courses, basic life support, advanced courses like SLS, PULSE, and NRB also. And also we are providing training for the staff in crash cart, or like crash cart awareness, defibrillator safety, drug and medication, and how to do documentation. Any more question? I'm waiting for your question. Still, we have time. Maybe, actually, maybe I went fast. Maybe if you want, I will ask you some question. Okay. So I will just give you a very simple question. What is the role of the third nurse? What she did, the third nurse? No answer? Okay, but let's make a comment about the high quality CPR and what this staff they did. Uh, For compression, actually, what I noticed, after we finish from the training, we are just debriefing what they did. As I noticed that the compression was shallow and not deep, not in good depth and good rate. So maybe this is one comment of high quality CPR. It was the compression was not okay. Okay, question? Any more questions? She's asking about this one. Oh, okay.
She answered.
Okay. Yes. Yes.
Yes.
Yes. Thank you very much. Yes, actually, this is the correct answer. She will bring the ambu bag and cardiac board to the code blue form. Yes, exactly. This is what she's supposed to do. Then after that, you will help in high quality CPR. Any more questions? Do you have query about basic life support? Okay, maybe you are thinking about question. Actually, let me take this time to thank my LSTC center team, nursing education. Actually, they give me support, especially the manager Ala, and also my colleague Khulud. Plus also these people who helped me in making this nice video. Jason, the clinical instructor, Jason and Merna. And also I'm giving big thanks to Dr. Agada, our director, and also my best friend, Abir Al-Hazmi. Thank you very much.